You were dispatched with 69-year-old female complaining of chest pain.
Alright, I've got my PPE. Is my scene safe?
Your scene is safe.
Alright, is this my only patient?
Your only patient?
The nature of illness is chest pain?
Chest pain.
Alright, so I'm going to call for additional ALS, and I'm going to consider the need for C-spine. When I walk in, what do I see?
You see a 69-year-old female sitting in her chair, clutching her chest, bending forward.
Okay, so when I walk in, does she follow me with her eyes? Is she alert?
Yeah, she's looking at you as you walk in.
Okay, so I can say she's alert. And so, hello, my name is Aaron. I'm with EMS. What's going on today?
My chest hurts.
Okay, so my chief complaint is chest pain. Are there any other apparent life threats?
Nope.
Okay. So she's talking to me normally when I speak to her.
Mm-hmm.
You know, okay, so I can clear her airway. Her airway is patent. What does her breathing look like to me?
Her breathing is a little fast and shallow.
Okay. So when I listen to her lung sounds with a stethoscope, does it sound clear? Is there any abnormalities?
It's clear.
Okay. So I'm going to go ahead and put her on high flow oxygen at 15 liters a minute with an armored breather mask. And I'm going to go on and check her pulse. How does her pulse feel?
Her pulse is weak and rapid.
Weak and rapid? Okay. Okay. So, is there any major bleeding anywhere?
No major bleeding.
Alright, and how does her skin look?
Her skin is pale, cool, and diaphoretic.
Okay. So I'm gonna make this a priority patient. Yep. So I'm gonna go ahead and get some history questions. What were you doing when this started?
I was watching TV.
Just watch TV? Did it come on just all of a sudden? Did it progress?
It started all of a sudden and then it got worse.
Okay. So, does anything make it better or worse, or change it at all?
No.
No. Does that move? What does that feel like to you?
Just feels like a lot of pressure on my chest.
Okay. But enough pressure to hurt.
Yeah, a lot of pressure.
Okay. And does that pain move anywhere? Does it radiate anywhere?
It kind of goes up to my left shoulder a little bit.
Your left shoulder? And if I was to ask you to rate it on a scale of 1 to 10, 1 being no pain at all, 10 being the worst you've ever felt in your life, how would you rate it?
Probably like a 9.
Like a 9? Okay, and have you ever felt this pain before?
Yeah.
Yeah. Okay. And how long has this been going on for today?
This has been going on for like 30 minutes.
Okay, so some of my cited symptoms are the pain, breathing issues, the skin condition, the pale, cool, diaphoretic, and the weak, rapid heart rate. So maybe do you have any allergies?
No.
None at all? Okay. And do you take any medication?
I have some nitro.
Okay, and have you taken any today?
No.
And you know where it is?
It's in my bathroom.
Okay. So, has you ever felt, you said you felt this before, do you know what it was at the time?
It was a heart attack.
You had a heart attack how
Yeah.
long ago?
About a year ago.
A year? Okay, and do you think you could compare that experience to this?
Yeah.
Yeah?
It feels the same.
And have you had any other, have you gone to the doctor for anything else? Gone to the hospital?
No, just for the heart attack.
Okay. So what was the last thing you had to eat today?
I had some toast and jam this morning.
Okay. Before this started, you were just watching TV, not doing much. All right. So I'm gonna go ahead and start my secondary exam. I'm gonna say it is circulatory because I do believe it is a heart attack. I'm gonna start by checking her distal pulses. So her radial. How does it feel? Still weak and rapid?
Yes.
Okay. And if I was to expose the chest and would I see anything there?
No.
No? Okay. So I'm going to get her vitals. What do I get for her pulse?
Her pulse is about 95 beats per minute.
95? Okay. Okay, and what do I get for the blood pressure? With the needle cuff?
160/80.
Okay. And what do I get when I watch her respirations?
25.
25? Alright. So, my field impression of this patient is that they are having a heart attack, or I believe they are having a heart attack. And I'm going to say, and for treatment, my team and I, we are going to give this patient some nitro. I'm going to start with 0.4 milligrams. And then continue to reassess, and if it gets better, we'll give more. I'm also going to make sure the blood pressure is high enough to give the nitro, and I will check to see if she's on any kind of ED drugs, I guess, before I give it to her. Also give her some aspirin for the pain, probably only 81 milligrams to start. And then I did give her the high flow oxygen at 15 liters a minute. So and then I'll reassess this patient every 5 minutes because they are a priority. So for my oral report for this patient, I have a 69-year-old female complaining of chest pain and has had a heart attack in the past, about a year ago. The patient has no allergies and only medication is nitro. Their vitals were, the heart rate was 95, blood pressure was 160/80, and their respiratory rate was 25. Yeah, and that's all I got.